So when did you become a nurse?
Well, it's interesting. So growing up, I never really had a career path that I was focused on.
I just kind of would hop around doing different odd jobs, but never really settling in on a specific career.
Now I've been a nurse in the healthcare system for about 3 years now. And yeah, I'm just about to finish my Masters of Nursing.
Well, I always wanted to be a makeup artist. I got into truck driving.
I got into truck driving after meeting Ed, my husband, but I always loved driving.
A lot of the men in my family, they're actually in construction. And so I thought, well, maybe I'll get into that. But they said to me, that is no place for a woman.
It was not the place for a girl. But I was always the biggest driver when I went out with my friends, and I didn't drink, but I loved to have the biggest car, and I just like the idea of being in charge, you know?
I think what really shaped my career choice was feeling the effects of bullying in school.
Really? Was this something that happened to you, or something that you saw?
Well, I experienced bullying, but it never really affected me that much.
It was more seeing the damage that it did to other people that made me want to help people.
Seeing how discrimination, just plain high school bullying, affected people really made me want to make a difference. And I think that's when I started wanting to become a nurse.
I think a person can get so beaten down and so afraid of who they are that that they lose their personality.
Sometimes it takes a lifetime to find it again. You obviously had some emotional maturity to see the damage that it does. I don't think you go into a healing profession if you aren't the kind of person who cares about other people.
Yeah, I totally agree. Nurses are definitely the type of people who just care about everyone. They put their patients first.
Of course, we all have those workmates who drive you crazy and insane because of things they do, but yeah, at the end, it's patients first.
So you certainly are part of a special lot. Do you experience a lot of discrimination being a male nurse?
Nowadays, there's not that much discrimination. I do get times when a female patient will ask for a female nurse because what they're having done is quite revealing and personal, which I totally understand. I don't count that as discrimination.
Sometimes a patient might mistake me for a doctor, and in which case I just introduce myself and say, hey, I'm Nick and I'll be the nurse looking after you today.
I suppose I should just think a nurse is a nurse. But I think some women, well, and men, think, a bit more doubtful about a male nurse. But they wouldn't say the same thing about a male doctor.
I often think male doctors get miles more compliments and thank yous than female doctors.
I've never experienced any discrimination. Look, I've had admiring looks, I had flirtatious behaviour, but I only ever once in 15 years had somebody make a lewd gesture towards me. But in general, the experience has been great.
I have heard stories from other drivers and read stories in trucking publications about women being harassed on the job or taken advantage of at shippers or receivers. But I've never experienced that myself. Maybe it's because I was raised in the city, but I'm more assertive than other women.
I was raised in an Italian family.
I'm Italian.
Yeah. And males and females had really traditional roles because the men were outside working and gardening and working, and then women were inside doing the cooking and the cleaning and raising the kids. So I was brought up in a real traditional house.
Actually, I was probably born in the wrong decade because I'm a total sucker for specific gendered roles on some occasions.
Kind of sound like I'm in the 1940s, right?
Yeah, a little bit.
I actually think what's more of a problem are people who automatically assume that they know your sexuality based on your profession. They just don't think that maybe, just maybe, someone is interested in a particular field because they aren't. People assume males in females' jobs and females in male jobs are always gay.
I'm gay, but I've never really had a problem with it.
I do think it's an assumption that a male nurse is automatically gay, but I'm one of 7 male nurses and none of the other guys in the department are homosexual. But trust me, I wish a couple of them were, to be honest with you.
My friend David, he's a nurse. He's gay. My hairdresser is straight. My nephew's in college learning to be a nurse at the moment. He's straight. I'm a truck driver. I'm straight.
And I know a lot of other female truck drivers and we're all straight. So But I do know some female truck drivers who are lesbians.
That stereotype or assumption does exist though. I was at a comedy show in Las Vegas once, and the comedian asked me what I did, and when I told him I drove a semi-truck,
And he said, oh, well, you must be a lesbian then. And everybody laughed, and I laughed myself.
And even though I was clearly there with my husband, he still made that comment. It didn't really offend me, but I thought there might have been some other people in the audience that didn't like it.
I've never actually faced discrimination over it. I find patients in their 70s or older are rather supportive. I even had a super friendly 89-year-old gentleman tell me to keep being me.
But yeah, I'm blessed to work in a profession where individuality is kind of well accepted as well.
The media often portrays male nurses as gay, yes, but that's not exactly something I can comment on because in my case it's true.
Yeah.
I think we're in a completely different place now. I don't think people think twice about people doing jobs that are normally dominated by the other gender.
yeah, but there's still assholes, no doubt, but people aren't as hardwired anymore to be so rigid of thinking who should be in what job.
And the younger generation say, can I call you a kid? You know, kids your
Of course.
age. I don't think they care about it at all.
To be honest, I haven't met many truck drivers, but no offense, are there a lot of females in your profession?
Back in the day, there was only like 5% of women in the industry, but now there's 8. So there's definitely more women joining the ranks than ever before. Yeah, and now there's organisations like the Women in Trucking Association that didn't even exist 15 years ago.
It's only recently that we're getting more males in the profession.
Even now, there's only about 5% of male nurses in Australia. It's less than truck drivers.
Yeah, totally.
Look, I know I'm quite traditional in certain ways, but you know, I don't actually have a problem with anyone doing a job that they really want to do.
Like if a woman wants to do a dangerous job, well then she can do it. If you were to Google dangerous jobs, a truck driver actually comes up under the role of a dangerous job, and I do
really?
it. So I do a dangerous job.
Women see things differently, react differently, approach problems differently, and I think this industry can use something that we have to offer.
My trainer, when I started learning how to drive a truck, said he thought women made better truck drivers than men. Yeah. And this is a guy that had been driving a truck for more than 40 years before he became a driver trainer.
When he started truck driving, there were no women, but there are now, and I'm also really confident. So I just thought I could do it.
Confidence is, definitely super important. Nursing is still a very eat you young sort of role.
I had a lot of situations where older generations of nurses challenged my decisions and my ability based on my age.
Confidence really helped me get through that. At the end of the day, our patients are the most important fact.
It should be the root of all nursing. It should be. I reflect on this a lot, and it's really nice to think back and see the difference you can make
Yeah,
at the end of the
that's
day.